Welcome, I'm Influenza Vaccine. I'm a pediatrician practicing in Morningside in South Africa. This is my passion, little children. I love seeing children in their natural setting, learning, discovering, going to school, playing sport and staying happy. Here we have the vaccine schedule that is produced by the Pediatric Management Group of South Africa, and we can see from the schedule, very busy slide, and by the time the child gets to 12 years of age, we see that there are lots of injections and lots of holes in this poor child's skin. However, on the left-hand column, we have a long list of illnesses which we're going to consider today. Influenza. Well, looking at these pictures, we all know how these poor patients feel. We all get it on a fairly regular basis. It's a highly contagious condition, and epidemics do result in mortality rates as well. The virus mutates continuously so as to avoid the body's immune system, and therefore vaccine development is difficult. As a result, annual vaccine development is required, and annual vaccination is required. Each year, committees sit in scientific fora and they decide what strains should be in the vaccine for that particular year. Administration is controversial. The administration is definitely recommended for high-risk individuals such as cardiac patients, chronic lung disease, diabetics. The American Association of Pediatrics does recommend that children between the ages of 6 months and 5 years of age should also be vaccinated annually. Personally, I don't like suffering from influenza, and I do like having my vaccine yearly. Some patients make the argument that the year they've had the flu vaccine, that was the year they were the sickest. However, some of those patients come back in subsequent years and still end up having the vaccine. And I've been assured by virologists that if they do get seriously ill, it's not the vaccine itself that causes that illness. It may be another illness, and there's no reason why the vaccine should make you more susceptible to other viral illnesses. In our pictures, we see someone sneezing and a huge amount of saliva and mucus going out into the atmosphere and spreading it easily from patient to patient, which then ultimately results in the little child with the extremely runny nose. And once again at the bottom we have a picture of the virus itself. Very clever virus. Makes us look stupid sometimes. So, having considered the facts pro and con vaccination, what is your decision? I came across this site on the internet. I consent to being forcibly restrained and injected with multiple viral strains, preservatives and heavy metal adjuvants. Said no baby ever. Having looked at all the facts in our talk, you can see that the effects or side effects of the vaccine are very small if one compares it to the devastating effects of the illnesses that we deal with. If we have a look at the right-hand slide, we have a child who's fully immunized and protected against these life-changing illnesses. In my opinion, if I had to choose, I would choose to vaccinate my children fully, with the knowledge that we are placing these children at risk if we don't vaccinate. So thank you for joining me, Enrico Maraskind, in this discussion. I hope I've shown you the reason for my passion for controlling the disease processes that we vaccinate against, and I hope it'll give you some insight into making your own decision of whether to vaccinate or not vaccinate.